you have pelvic floor dysfunction if you find yourself doing this. So stay tuned. Hey, this is Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine, Orange County. We are so looking for loud clues as to if we have a condition or not that we fail to look at all these big problems start as little problems. You have pelvic floor dysfunction if you find yourself standing on one leg versus the other often, or not so often. If you've got 2 feet, your brain is designed to program your movement and your posture to stand on both feet. If you find yourself standing on one foot versus the other, leaning or just holding on to something, if you're sitting down and you have to use your arms to support yourself, you have pelvic floor dysfunction. It's just not loud. This is a subtle sign and symptoms of pelvic floor dysfunction. Why do I say that? Because just think about it. I've got a bowl called my pelvis. The legs are like the legs of the table. Granted, you can't have a table with 2 legs, but you get the analogy here. If you're standing on one leg, what happens to the other one? You're going to be creating an imbalance. That imbalance is not going to pain you. It just creates a habit that impacts your movement, and now it's your movement that complicates this issue even further. Next thing you know, even within the inner side of the pelvis, the bowl, which is more than the floor, the walls have muscles too, the outside of the bowl have muscles too. Next thing you know, this whole pelvis becomes imbalanced. That means the house that pelvic floor is the floor of is imbalanced, which means the floor is going to be imbalanced. Listen, it's ludicrous to think that we can strengthen the floor when the house is unstable. If this does not make sense to you, I would love to hear from you. I want to know what you're thinking. What part of this does not make sense to you? If it does make sense to you, then the question is, what is it that you're doing about it? Are you like Googling how to do abdominal crunches? Because that's not the right answer. Are you trying to figure out how to do this on your own? Good luck. If you have any questions about what I just presented to you, I encourage you to take advantage of the information in the description box. Contact my office. It doesn't matter if you're close to my office or not. Let's talk. Let's see what's going on, and let's see how you can help yourself. Hope this helps.